topic of our presentation today is wrist injury. Here is the anatomy of the wrist. These are the ligaments around the wrist, and these are the bones and joints of the wrist.
De syndrome. De syndrome is tenosing tenosynovitis of the first dorsal compartment of the wrist.
The patient will feel pain and swelling over the radial side, which is the thumb side of the wrist. It occurs due to inflammation, thickening, and stenosis of the synovial sheath. Condition is more common in women, and the patient will complain of pain with movement of the wrist as well as swelling with tenderness of the styloid process. These are the activities that may cause De Quervain syndrome. Pain is usually located at the base of the thumb and to the side of the wrist.
A cough test.
The test is conducted by having the patient making a face with the fingers closed over the thumbs and the wrist is bent towards the little finger. The hand is put so that the involved tendons are stretched, causing sharp local pain if injury and inflammation is occurred. Conservative treatment for De Quervain's disease includes taking anti-inflammatory medication, thumb spica brace, or steroid injection. Injecting steroids into the tendon sheath of the first dorsal compartment with the wrist over a roll-up towel. Next is surgery. It is done after failure of non-operative operation. Surgical release of the first dorsal compartment. It protects the radial sensory nerve and identifies all other compartments. The tendon may have separate compartments and each compartment should be identified and released. Also, the abductor pollicis longus tendon may have multiple slips. Pain may occur after surgery due to neuroma, inadequate decompression, or instability and scarring of the tendons. De Quervain's release surgery. It is release involving the first dorsal compartment of the wrist. Complete decompression of the first dorsal compartment including any additional slips. The abductor pollicis and extensor pollicis brevis tendons are freed from the surrounding retinaculum and tendon. It is important to protect the radial sensory nerve.
Next injury is a carpal tunnel syndrome. Carpal tunnel syndrome is compression of the median nerve at the wrist. It is the most common form of nerve entrapment.
Tunnel is a narrow passageway on the palmar side of the wrist made up of bones and ligaments. Pressure placed on the median nerve due to thickening of the transverse carpal ligament. Numbness and tingling in the radial. Numbness should be less at the thenar area of the palm. Next is clumsiness and weakness, pain, and also paresthesia. The functional test for De Quervain's disease is Phelan's test. Ask the patient to perform wrist flexion maximally. Wrist volar flexion for approximately 60 seconds will produce symptoms. These are the first line of treatment, including night splint in neutral, steroid injections. Failure to improve after injection is a poor prognostic factor. Surgery is less effective in patients who see improvement with steroid injection. The site of injection is 1 cm proximal and 1 cm ulnar.
Last injury is the scaphoid fracture. The scaphoid bone is the most common carpal bone to fracture. Fracture of the scaphoid usually occurs from a fall onto an outstretched hand. The patient will present with wrist pain and swelling. The injury may be mistaken for a wrist sprain. Look for tenderness in the anatomic snuff box.
The X-ray may be negative. When a scaphoid fracture is suspected, immobilize the wrist adequately with a thumb spica for a short period of time. However, fractures of the scaphoid can be missed. Fracture types. First is wrist fracture. Most frequent fracture site and has moderate risk of avascular necrosis and non-union. Type 2, distal pole fracture. Avascular necrosis is rare. Type 3, proximal pole fracture, high incidence, non-union, and avascular necrosis. Type 4, tuberosity fracture. The blood supply of the scaphoid is unique and tenuous. Scaphoid fractures can lead to non-union and avascular necrosis due to interruption of the blood supply. Here's how you manage scaphoid fractures. Treatment includes operation and fixation. It can be fixed by compression screw. Next is non-union fibrous type. Non-union can also be fixed using bone graft along with compression screw. Here's are exercises need to be done. First is flexibility exercises. Now let's take a look on exercises need to be done. First is flexibility, which is wrist stretch. Press the back of your hand with the injured side with the other hand to help bend your wrist. Hold for 15 to 30 seconds. Next, stretch the hand back by pressing the fingers in the backward direction. Hold for 15 to 30 seconds. Next exercise is wrist flexion stretch. Stand with the back of your hands on a table, palms facing up, fingers pointing towards your body and elbows straight. Now lean away from the table. Hold this position for 15 to 30 seconds. Another exercise is wrist extension stretch. Stand at the table with your palms down, fingers flat, and elbows straight. Lean your body weight forward and hold this position for 15 to 30 seconds. Next is strength exercises. Firstly is resisted forearm pronation. Sit leaning forward. Grasp one end of exercise band with your palm up. Step on the other hand. Keeping your wrist straight, roll your palm inward toward your thigh for a count of 2. Then slowly move your wrist back to the starting position to a count of 5. Repeat 8 to 12 times. Next is resisted supination. Sit leaning forward with your legs slightly spread, then place your forearm on your thigh with your affected hand and wrist in front of your knee. Grasp one end, keeping your wrist straight, roll your palm outward and away from your thigh for a count of 2, and slowly move your wrist back to the starting position to a count of 5. Next up is resisted ulnar deviation. Sit leaning forward with your legs slightly spread, then place your forearm on your thigh with your affected hand inside of your knee. Grasp one end with your palm down, step on the other hand with the opposite foot. Slowly bend your wrist outward and toward your knee for a count of 2, then slowly move your wrist back to the starting position to a count of 5. Now is resisted radial deviation. Sit leaning forward with your legs slightly spread, then place your forearm on your thigh with an affected hand in front of your knee. Grasp one end of exercise band with your hand facing toward your other thigh. Slowly bend your wrist upward for a count of 2, then lower your wrist slowly to a count of 5. Next exercise is resisted wrist flexion. Sit leaning forward with your legs slightly spread, then place your forearm on your thigh with your affected hand in front of your knee. Grasp one end of exercise band with your palm up. Slowly bend your wrist upward for a count of 2, then lower your wrist slowly to a count of 5. And lastly is resisted wrist extension. Sit leaning forward with your legs slightly spread and place your forearm on your thigh with your affected hand in front of your knee. Grasp one end of exercise band with your palm down. Slowly bend your wrist upward for a count of 2, then lower down for a count of 5. Repeat 8 to 12 times.
Here are the training plan for wrist injury.
Now let's take a look on the conclusion and recommendation. The powerful wrist muscle are able to place the hand in almost infinite number of spatial orientation. Form of treatment must be selected to achieve position, muscle strength, stability, reduce pain, edema, and range of motion. Rehabilitation exercises are crucial in order to speed up recovery process. Functional wrists are vital in order for the hand to perform coordinated manipulation, power grip, and strong rotative action. Strengthen muscles so it prepared for activities and will not easily get injured.